women could choose where they delivered their babies, they came to our clinics and then went to some other hospital to have the baby delivered. We could even lose even more money through the adult business if most of the communities we serve, the patients elect to go somewhere else for their care. The lack of that Medicaid money will hurt the poor, those people that still fall between the cracks and don't have Medicaid or insurance. We're worried about that. We're trying to figure out what do we do with that. And that's another reason we want to become easily accepted, accessible to the patients, caring, clean, responsive, and delivering quality health care efficiently. We want to make our system such that people want to come to us, not because they have to come, because they can come. In other words, we're trying to develop a strategy that is responsive to the needs that you and others identified in our first round of town hall meetings. As you know, we had 7 town hall meetings on the first round to get some inputs, and I'll review with you in a minute what those inputs were, and Mr. Foley will then go over them again. This is the 6th out of 7 town hall meetings we are conducted the second time around to get the community's reaction to the concept we developed on what we heard during the first round and from the work of the consultants, numerous special meetings with other groups. Well, I think this is probably the first time in your 20 years on the board that there's been a real attempt to find out what the community thought. We want to be open, transparent, receptive, and listening. We can't deliver everything, but we need your help to get to where this group thinks we need to go. One of the things I have to point out that we were made aware of once again in one of these town hall meetings. It was the last one or the one before last. Last year, after meeting with a group of South Suburb ministers at Oak Forest, we decided we needed to set up some community advisory boards. And that good thought fell by the wayside when we became swamped with trying to get our budget approved, recruit a CEO, and what seemed like a zillion other things happening all at one time. This time, it reminded us that we should do that, and Mr. Foley and I agreed we will do that. We'll find a way to set up an advisory board of community people from the various communities we serve. They're not all the same. They don't all have the same needs. We would like to have a group of people that we can regularly sit down, try ideas out on to see what they think of them, get their ideas to bake into us, and see if we can get this more of a broad-based, well-supported system. Now, what did we hear the first time around? There's a need for greater access, both closer to where you live and access to doctor's appointments quicker and any other care you need quicker and with shorter lines. Last night we heard an older gentleman talk about his clinic appointment being changed 4 or 5 times. We can't treat people like that and have them expect to come to us. We've got to find a way to make an appointment and deliver. Pardon me. Pardon me. So access is something we've got to work on in 2 different ways, and it's going to take a long time and a lot of work to get that done. We need the need for more preventive medicine, more available to you, such as screening for breast cancer and colon cancer. There's a real need for dental care in Cook County. There are only 5 dentists on our payroll, and that's, 6.5 million people. I don't know how many of them need our care, but that's not nearly enough. There is a real need for mental health care. That we don't do much of all, I don't think. Sorry? There is no, sorry? There's no way we can meet these needs and keep the system the way it is. So we have come up with some concepts that could come close to meeting those needs, but would require us to find ways to operate even more efficiently in the future. Tonight, please give us your constructive reactions. These are concepts. These are not plans. They're in the stage of being put together. There's a lot of work that needs to be done on these concepts. As they always say, the devil is in the details. Some of them might not work at all when we get the numbers, but this is where we're starting from. By the way, each of these concepts is in operation today somewhere in the United States. Tonight, together we could build a strategy that in the long term that could contribute to improving the overall health of the citizens of Cook County. So now let me introduce Bill Foley, our CEO. Bill has 35 years experience in the healthcare field, with 20 years as the CEO of a hospital or a hospital system. He was the CEO of the Provena system in our area, and he turned it around. He was the CEO of Montgomery County Public Hospital when we recruited him. Montgomery County is the home of Pebble Beach and Carmel and all that, but on the east of Montgomery County is all agriculture, with a great many poor people needing health care. He was able to deal with that and help provide health care to those people. So in a very short time, he's recruited or promoted a first-class management team and led the development of the concepts we're going to go over with you tonight. Heather O'Donnell, another one of our directors, is